Do younger people at risk for heart attacks need more statins? That's a question that a new paper in Journal of American College of Cardiology tries to answer. And as you can guess from our sort of healthcare's prescription-based perspective, the answer they come up with is basically yes. I'm Dr. Brett Scher, the medical director at dietdoctor.com, and I want to explore this article because I think it points out a really interesting sort of dichotomy of views between what our contemporary healthcare system believes in terms of prescription first type mentality versus what some people think is a more important lifestyle first mentality. So let's talk about some of the specifics of this study. So it was at Duke University. They looked at 6,600 patients who came in with a first-time heart attack, and they stratified them according to age, classifying those as being young if they were under 55 years of age. And then they looked to see how many of these people who had a first-time heart attack, based on their lab values, their risk factors, their health status before the heart attack, how many would have been designated as a statin candidate. And they actually compared the 2013 cholesterol guidelines to the 2018 cholesterol guidelines. And what they found was less than half were actually identified as a statin candidate, meaning, you put them into the calculator, use all the guides, use all the criteria, and the result is that the recommendation is not to treat with a statin. And even fewer, though, were considered statin candidates in 2018 by 2013. Okay, so as you can see where this is going, it was all about focusing on the statins. And would these people benefit by having more statin prescriptions? Now, what I find really interesting is when you look at their LDL cholesterol level, the average LDL for those under age 55 was 117. That's actually really low, pretty low for general population primary prevention. In fact, a third of them had an LDL below 100, with a certain percentage even below 70, which is where you're supposed to not have heart attacks, but clearly you do. So the point being is that these are hardly LDL numbers of wild concern to suggest that LDL was the biggest problem for these people leading up to their heart attack. It suggests that there was definitely something else going on. And it turns out the data presented in that same paper shows that that is indeed the case. So what else did they find? Well, 51% were active smokers. Okay, that's a no-brainer. You can give as many statins as you want to active smokers. You're not undoing the damage being done by smoking. So, I can't believe they didn't even recognize that in the paper. Smoking cessation is going to do far more than any statin prescription. Okay, but what else? 41% were obese. 66% had HDLs below 40. 21% had full-blown metabolic syndrome. 19% had actual diabetes. And 46% had high blood pressure. Well, guess what giving them a statin is not going to do? It's not going to fix their blood pressure, help their diabetes, help their metabolic syndrome, help their HDL, or help them lose weight. A statin prescription isn't going to do any of that, yet the whole article was about statins. And that's where we have this complete disconnect and myopic view of our healthcare, I guess you can say healthcare society or healthcare bias, that the article was still all about statins, where I would turn this around and say, yes, you are absolutely right. The basis of this article, that we are missing a chance of intervention and improving the health and the lives of those under 55 at potential risk of heart attacks, we are absolutely missing an opportunity. But that opportunity doesn't come from a prescription pad. That opportunity comes from the lifestyle interventions that are going to address the high blood pressure, the diabetes, the metabolic syndrome, the HDL, the obesity. One lifestyle intervention or a combination of lifestyle interventions that can affect all of those. So is low carb lifestyle the best one for that? Well, it certainly is a very effective and viable option for that. You have to find the lifestyle that's going to work for you, that's going to be sustainable, that you're going to enjoy, that's going to help you decrease the frequency of eating, help you maintain a healthy negative caloric balance without resetting your metabolic rate, that you're going to enjoy it and have good energy and feel good on it. So a low-carb diet certainly fits most of those criteria, and also one that's going to help reduce your blood sugar and your blood insulin with the metabolic syndrome and diabetes. So low-carb absolutely fits that. There may be others that fit that for different people. But in my experience, a low-carb lifestyle combined with exercise and time-restricted eating would do far more as a primary intervention than focusing on statins. So anyway, I hope that helps you see things from a different perspective, because in medical journals and in many doctors' offices, it's not the perspective you get, but it's the perspective we want to provide here at Diet Doctor. And that's why we have guides and resources and courses to help you learn how to improve your lifestyle and improve your health. All right. Thanks a lot, everybody. Thanks for watching. Make sure you click subscribe down below so you'll get all our updates. And if you thought this was helpful, give it the thumbs up. Take care.